They have Medicare A and B that covers 80%, generally speaking. That means you are responsible for 20%. But in original Medicare, having A and B, you might have a prescription drug plan as well. In that scenario, you have a responsibility of 20% that is uncapped. So if you have continual, issues, you're going to have a lot of expenses that are still associated with your healthcare costs. So having something like a Medicare Advantage plan will immediately put a cap on that. It'll also take care of a lot of different things that Medicare A and B just doesn't have. Um, Dental, vision, and a lot of other extras that are coming with Medicare Advantage plan. So there are some network things that you need to be aware of, but for the most part, the issues that have been a problem before previously, Medicare is always changing, and from year to year, we see drastic changes, especially in the last 5, 10 years. So some of those issues that people are saying, "Oh, I don't want a Medicare Advantage," I would say let's revisit this because generally speaking, a lot of what you've heard before, it just doesn't apply anymore. We have a new landscape of Medicare, and things are changing. So it's really good to connect with myself, somebody who's an expert in this area that can help you walk through the basics, especially if you're aging in or you're concerned about a family member. You're doing the homework for them, maybe, and you need somebody to help kind of shoulder that burden of figuring it all out. So I have a pretty easy process to just kind of walk you through. And basically, I'll take an assessment of what the needs are of the individual and then see what's available. And then, have basically there's going to be one plan that's going to emerge as most valuable to them in their area, and it'll be suitable. They're eligible and qualified for it. So that it's a little bit of a process, but I feel like this is one conversation of a much larger conversation about finances. So it really is about getting you the protection that you need so that you can mitigate any kind of medical expenses that are associated with like large copays, things like that. So better coverage and lowering costs is the goal here. So if you need help with that, there's a calendar. There's a couple of links down there. So reach out. Love to help you out. Take care. Bye.